Thank you for joining us on the Vida Las Vegas podcast. Emily, tell us a little about yourself.
Hey, thanks so much for having me this morning. My name is Emily Encinosa, and I am a home birth midwife that serves families here in the Las Vegas Valley and in Henderson.
Excellent. So let's talk about what a home birth is, because
some people don't know.
Exactly.
A home birth is an out-of-hospital birth that typically we support women who are having low-risk pregnancies. So there are specific candidates that qualify for a home birth, but when you work with a midwife, we really respect the natural physiological process of labor, and we view labor as something that needs to be, or it can be, undisrupted when there is no reason for medical intervention. And so our jobs is to work with families to keep them educated in their choices and make decisions along the way to keep them informed and healthy so that they can prepare to have an out-of-hospital birth experience. We do work with hospitals, and we don't deliver in the hospital, but usually we will be able to facilitate and have some support in an event that someone can't stay home any longer. But here we primarily work out of the hospitals. And then we do have nurse midwives that work in a hospital. So you still can work with a midwife, but I'm a home birth midwife, so I don't go into a hospital to deliver a baby.
So how does one choose or even think about the process of that? Because I think the traditional route is you think about, well, I'm just going to have to go to the hospital. How does one be like, okay, I want to do this, or like what are things that people might need to think about before deciding to go a home birth versus in the hospital?
That's a great question. Some moms already know because maybe that's something in their family or culturally that is acceptable. It's something that I feel that is becoming more popular over the last 5 years. You're seeing it more on social media. You're seeing more celebrities make the decision to not experience a hospital birth, or they're going to like birth centers or just seeking alternative ways. So sometimes we do have women who already set out because they've had experiences or seen experiences prior to this pregnancy that made them want to look into home birth. We also have a lot more families that do actually start seeing care providers in the hospital, and then maybe around like 20 to 28 weeks, sometimes what they're saying or the support that they're getting isn't really in alignment. And so they're learning about their experience and preparing for their experience through childbirth education or maybe having a doula. They're asking questions and getting educated. And then they're seeing that some of the things that are done in a hospital aren't necessarily in alignment with the beliefs that they have on birth and what that experience looks like and the kind of support that they're looking for. And so we do have some people who will transfer care at a certain point in pregnancy if that's the decision. I also have second-time moms that sometimes don't have great experiences or they were looking for more support. And that is what makes them motivated to look into more holistic midwifery care. We offer prenatal care to where you can still see us and then deliver in a hospital. So sometimes home isn't always the right place for a person, but being able to have your options and have someone that really wants to give you more holistic and individualized care instead of just kind of checking off boxes and seeing you for 10 minutes at a time, that would be a motivator for some women to come and then want to even just do prenatal care with us and then deliver in a hospital. So we do offer all of that, but it really depends upon the experience. It's either something in their background that's acceptable culturally, or it's something that they're realizing that they're not getting that experience or that level of care from the provider that they're already seeing.
Could you tell us the difference between a midwife, an OB-GYN, and a doula?
That is a great question, too. An OB/GYN is someone who is mainly only delivering in the hospital, and they are also able to perform surgery. So that is the biggest difference between what I can do, even a nurse midwife in the hospital, and what OB/GYN could do. They are able to do cesareans. They can also use like a vacuum in an event that was needed in a delivery, but primarily they can perform surgery. So they can go back and do a cesarean birth if that's necessary. And they all work in hospitals. nurse midwives can give medication. And so the difference between myself and a nurse midwife, when a nurse midwife works in a hospital setting, she is not able to do a cesarean, but she is able to provide medication like Pitocin if needed in a hospital setting, or any sort of antibiotics in a hospital setting. And so, for example, I am not able to do those things. As a home birth midwife, I don't practice medicine. So there's herbs and ways that we talk about improving your health with eating and nutrition and getting rest and more of a holistic approach versus giving medication to either intervene in your prenatal care and support you or change what that labor looks like a little bit. And a doula is really the person who is there to give you emotional and physical support for your birth. And so a midwife, same thing as an OB, we deliver the baby, and OB also delivers the baby. They're in charge of your prenatal care. An OB/GYN will usually see you once in postpartum, whereas when you do work with a midwife, we typically see you and baby 3 to 5 times. So the difference also with what I do is most home birth midwives are also responsible for baby's care. So I'll have families that will see me and a pediatrician for their baby, or they might just see me for those first 6 to 8 weeks and then get in with a pediatrician. If all is well, there's nothing necessarily that they need to be doing. If they wanted to vaccinate, they would go and see a pediatrician, or if they wanted to do a circumcision. But otherwise, well checks and milestones for those first 8 weeks, I'm also able to do. And so that's a great benefit, because when it comes to postpartum anxiety and depression, we're really falling through the gaps and doing a big disservice to mothers and families by only seeing them at 6 weeks when a lot is really going on in those first 2 to 4 weeks. So that is where the midwifery model of care can be a really good benefit to mothers, especially women in America who sometimes don't even have proper maternity leave that's giving them more than 2 or 4 weeks off.
Oh yeah. So as far as a home birth, let's kind of talk through, what one can expect. Because you think about, like, where does one choose, like, in their house? Like,
yeah.
what's that process like for, you going with your families and kind of helping them decide what place that they want to do, and even if you want to talk about a water birth too, I think
Sure.
that's really awesome.
We talk usually around 20 weeks is when we talk to our clients. If they're starting care with us, we have a specific checklist, the Well Rounded Momma midwives. Most midwives, our job is in a prenatal to prepare you for your birth. So we're going over all of these things. Around 20 weeks, we start talking about that. Where would they like to give birth? If they want to give birth in the water, what does that setup look like? Sometimes you can rent a tub. We have people who do that here. We also give inflatable tubs. We have birth tubs that we give out to our clients, or they could do it in their bathtub. And so it's really the most intimate place, the place that you feel that you can surrender and go within and really allow yourself to experience that primal aspect of labor, and where you feel the most safe. So sometimes that's in someone's bathroom with the lights off. Their bedroom is a very common place to be in labor and have a baby. A lot of people do it in their living room too, just because it's a little bit bigger, and that will allow for a tub or access of the midwives and the doula and the birth tub and all the people that are going to be there. But primarily, it's really intimate spaces are really what we're looking for. I don't have any expectations or parameters that someone needs to meet as far as where the space they need to deliver in, what that looks like. I do want it to be a sterile space as much as possible. My equipment that I bring in my setup, I have a sterile mat that I put things on, and usually I'll put it on like the bathroom counter and keep it away from things. But like if there's pets around, sometimes I request that they're not close to just my tools. But other than that, that's the beauty of home birth, is that you can be upright, you labor as you need to, you can eat as you need to. There's no sort of set expectation of what that looks like. You can get in and out of your bed, you can get in and out of your tub. We really respect the freedom of movement and the ability to nourish your body and just take the time that you need to finish the process.
I could see like how a birth is depicted in a lot of movies. I mean, this is essentially like what I can imagine as what most births are like, and probably in more like a hospital setting. Is there anything that has surprised you along your
In
career?
labor?
Yeah, in labor, where you're like, wow, how did this happen, and how do we end up here?
So with home birth, the idea really is that we're respecting like the gentle process. So labor is very much a physical thing. Sometimes we see women that show up in an over-exaggerated version of themselves. And so in the movies, when you hear that woman and she's like, ah, and freaking out, usually if I were to go over to somebody's house and they are not in the throes of labor and kind of having that, like, this is really tough moment and I'm physically seeing the hard work happening, I'm like, you're not in labor probably. Because it is to that point of active labor and transition, it really does get to that intensity, which isn't really meant to be scary. It's meant that this is just your body physically going to that point and how your hormones and everything are reacting. But I do think that movies kind of set that up to where it's a scary thing. Sometimes with an epidural, women in the hospital don't have that experience. They don't feel this like crazy throes of like something happening because the narcotics are changing what that looks like. So in a hospital setting, you don't usually see that unless they are choosing to go unmedicated. Some women still feel contractions very much because epidurals aren't always perfect, and I have plenty of failed epidurals that I've experienced in my years as a doula as well, where we are still kind of feeling that intensity. But primarily at home, yes, that intensity is happening. But we are taught to respect that. And throughout your prenatal care, I always encourage anybody that's going to be at your birth to come, because that is the thing that scares people the most, or partners or moms or someone, is when a mom is really at that really hard part. She's shaky, she's probably vomiting and maybe going to the bathroom, sitting on the toilet a lot. There's some bloody show happening, and that looks really intense and scary, and we don't want her to go through that anymore. We want to take that away from her, but that's usually when we're right at the end. And then pushing actually feels really good, and that was something that I didn't expect probably until I went through it myself even. When your body gets that sensation and we allow that fetal ejection reflex to naturally happen and baby to get low and for your body to do it on its own, which we let in at home more often than not. You wouldn't really see that in a hospital sometimes because we're laying flat, or the narcotics that we have don't take that sensation away a little bit. So when we have someone who is not experiencing that dulling of the sensations or the hormones in labor, that is like a very strong urge. And I don't have to do anything. So the thing that surprised me the most, coming from a doula, watching a doctor do a delivery and the amount of hands that they have in a woman and also like on a baby, when I allow things to happen and just sit there and don't need to use anything, that is probably the thing that blew my mind the most. I was able to be at a birth with my preceptor. It was right before I got pregnant. It was right before 2020. So it was like, yeah, I think I had been in my apprenticeship for a year at this point, and we were at a birth. It was her third baby, and my preceptor was like, watch, she's pushing. She was laying on her side in her bed, didn't do anything. And like normally we don't need people to lay on their back. That's where she just felt the most comfortable. And she just had her baby and picked her baby up and put her baby on her chest. And I was like, oh, wow. And she's like, that's how it's supposed to be done. Because it really can. With first-time moms, sometimes that's less likely because nobody's carved that path before. However, it's nice being at home because we allow you to be upright. We let babies start to crown and do the thing. So even with a first-time mom, there's nothing that I have to do. It just might take a little longer. Because nobody has ever been there. But usually those things can be completely hands-off. If there's a reason, I know how to look for those things and check and help if that's necessary. But the beauty of birth is that it happens without anybody needing to disrupt it or touch it or do anything with it. A baby's going to come.
Could you also describe, there might be different areas, like you mentioned, like upright or sitting on it. And can you describe a little bit more, because maybe people might be listening, might not be familiar with, in what positions you can essentially give birth. And you want to kind of go through some common ones that you might see or that surprise people who aren't familiar with the birthing process?
Absolutely. I think upright births are really uncommon in a hospital. They'll let you start pushing upright, but then once the doctor gets in, usually once baby's crowning, they do want you on your back. Sometimes I have to do that with a mom at home, so it's not uncommon or the worst thing in the world. It can just put a lot of strain on your pelvic floor. And what do you all deal with? Recovering all of that. And me too, when I have moms that have had a baby before, and that's what they said, that they had like all these tears, they hated pushing. So upright, actually laying on your back and pushing like that is called McRoberts. And then we can have reclined, where sometimes you're just laying back and your legs are up a little bit, or one leg is up. We can do a semi-squat. You can push on your side. I've had moms just laboring upright, like in a squat position. Pushing on their toilet is really helpful. Hands and knees is great. Anything that feels comfortable for you. We're trained to be able to deliver a baby in any position. So it doesn't have to be something. There's things that we look for if we need to change it. But for us, most of the time, a mom is reclined in the water. Or she's on like hands and knees. She's leaning over the side of the tub or leaning over and maybe with one leg up, like a single leg squat in the birth tub. And then we're assisting getting the baby from behind, and then we pass it through after the baby's born. So the baby's in the water for a little bit, but then they come right out. They're not underwater for very long.
You want to talk about that process? Because I'm
Sure.
sure it shares, when people watch that, they're not really sure about what that happens.
I
and, like,
know.
why that might make sense to have a water birth or...
Sure. So I really think water is fantastic for getting through your contractions, for labor comfort. A lot of people say that water is also helpful to be able to deliver your baby in, because it takes away the pressure and the intensity of your baby getting so low in your pelvis. Some women don't like the buoyancy because they can't bear down. And so it really is different. I have some moms that will want to like sometimes get in and out of their tub to push, which is fine. If they want to deliver in the water, we'll just get them back in the water as the baby gets lower if we start to see some hair. But usually that's all we're doing. So women are just, I'm waiting until I start to hear that urge, no matter where you're at, but specifically in the water, I'm waiting until I start to hear that vocalization of some bearing down happen. Now, it depends if it's a first-time mom or a second-time mom. Every delivery is different. Even a first-time mom could be like going very fast, baby's there, and it happens. But usually I'm not like going down and checking for anything until I start to really like see maybe some like bubbles in the water, or if I see a little bit of mucus or some bloody show, or it looks like potentially the water. That's hard to tell sometimes if like a water breaks, but a mom might vocalize that, like something popped when they're in the water. And then I'm like, okay, that's probably like baby's probably close or coming. Sometimes I'll encourage a mom to check and see how far their baby is, because for us at home, we don't rely on cervical exams all of the time. I just need to know, say, for example, if a mom was in the water pushing and it had been an hour and I didn't see a baby, then maybe I would say, hey, is it okay if I get you out of the tub and do a cervical exam so that we can see where you're at? There might be a little bit of cervix still left, in which case we might change some positions and then see how you feel and come back to pushing. Because again, we don't need you to start pushing and then and finish that right away. You don't have a timeline. If that urge isn't super strong or if baby's kind of high, we're not going to burn you out. And so in that case, I might check someone and then get them out of the pool for a little bit, change their position if it's not quite time yet. But if that baby's there and that urge is happening, I might ask mom to say, hey, do you want to put your finger and see how far, or like if you can feel the top of baby's head? It feels a little squishy. And so they'll kind of check and then they'll tell me like, it's to here, or like their knuckle or sometimes. And then I'm like, okay. And sometimes I will do that as well. It's a little harder to do that. I don't love doing cervical checks. Or checking for babies that I might not know that are, or I might feel that they aren't as low, because it's hard to get from behind. For me personally, I want to make sure that if I'm going to check your cervix, I'm going in once and not having to like make any mistakes. I want to get all the information. So I will ask a mom to do it, and then she'll tell me like, yeah, I feel it, or no. And so usually it really just depends on what that urge is doing. And then we always carry flashlights. Sometimes I don't need them depending on the time, but in the water, I'll usually check in the water and look. on mom, like behind mom, and see if I can see any hair floating, because that's typically how it happens. When you start to see baby get lower in the pelvis, your labia and everything really starts to bulge. That vaginal opening starts to come, right? So babies don't just come out and crown right away, but they kind of start to make that happen. And for a first-time mom, when baby's rocking underneath the pubic bone, that takes a lot. And so it takes a couple times, and then finally baby gets under and they stay. But sometimes we see that, where we see a little bit of baby's head and then we don't. And then we see a little bit more of baby's head and then we don't. And that's okay. There's nothing wrong with that, but that's usually what it takes, is we just start to see more hair or more of baby's head. And then eventually there's the push and baby's head is out. And in the water, that is fine. There's nothing that I need them to do. Baby's not breathing. They're still connected to their cord. They're getting all of that beautiful oxygen and blood flow from the cord, from the placenta. That's working so well for them because our bodies are amazing. And then usually within the next contraction, baby's shoulders are born. So they rotate, shoulders and body come, and then we just bring baby up and put baby right on mom's chest, and we wait for baby to cry, and that happens within the first 60 seconds. Sometimes we do give some stimulation to help. Occasionally they might get some fluid in their mouth, in which we do have all of the things to help clear the fluid. We carry a bulb suction. We have all of our tools to be able to help resuscitate. That's typically not from fluid. But we have everything in the event that we needed to help baby if they needed some help breathing or some extra stimulation. But usually we just bring baby on mom's chest. They're there. We really wait until we're starting to see a little bit of blood in the pool that's from the placenta starting to detach from the uterine wall. And then we wait for the placenta to come. So we don't actually cut the cord until your placenta is delivered. And that's just how we practice. Most home birth midwives do that. Some don't. Some do. It really just depends on what their protocols are. But we respect a full delay of cord clamping, or of cord, like blood. We want to give baby all of their cord blood. So we wait for the placenta to be delivered, and then we help your birth partner, dad, your partner, whoever that special person wants to be, kiddos, brothers and sisters have cut the cord before. We do that with them. And then usually we go ahead and get baby into your partner's arms, whoever is going to take them, and then we clean mom up, get her out of the tub, and get her flat back in bed or on the couch, wherever she's at. And we usually clean people up, get them in bed, get baby on their chest, and we let that hour happen. So that golden hour, that undisrupted time of bonding is so important for breastfeeding, for oxytocin release within mom and baby and dad even. And so we let that first golden hour happen before we come in and check on baby. We're going in and checking on mom's bleeding. I'm doing some vitals at that point. But usually I'm not in there every 15 minutes or so much if the bleeding is minimal and there's not a lot of things that I need to be looking at. Checking baby's temperature, making sure that they're warm, all the things that they would normally do in a hospital, we're looking for those things. When baby comes out, we're listening for heart rate and respirations. There's always going to be 2 midwives at a home birth delivery together, and that is in the event that if we need help, we have one person for mom and another trained person for baby. So we work in pairs. That's typical, unless sometimes the birth can go fast and one midwife gets there and then the next comes after, but typically we are both there together, so that way we are able to manage postpartum bleeding, vitals, make sure that baby's transitioning well, and then we do the newborn exam and the weight and measurements at that first hour, and we get to do that in bed and feed mom, and you can eat whatever you want, you can have the lights low, and then we clean up and leave after. We're usually with you for about 2 or 3 hours after, but we clean up and it doesn't look like you just had a baby in your living room or on your bedroom floor. So it's pretty cool when you get to wake up the next day and you're like, wow, I don't have to go anywhere. I don't have to worry about installing a car seat or anything. Sometimes that's nice, but you should do it anyway beforehand to be prepared. But yeah, so that is really, I think the beauty of it is we just let that happen. There's nothing that I'm specifically watching out for. I know what to look for, and there's signs that we're trained to say like, hey, let's change positions. But for us, that's a big thing too. We've talked about that before, is changing the shape of your pelvis when it comes to pushing. And even women that are birthing in a hospital can benefit from that. And even with an epidural, you can still change the shape of your pelvis, and that's really what helps baby make that rotation in labor and get through your pelvic outlet and get earthside a little easier.
That's great. It seems like you help women to kind of get some control too during their birth.
Yes.
Because I know that can be really hard when they feel like they lose that sometimes.
Very much. And we talk about your birth plans. We do a love languages quiz. Specifically, this is with my practice. When you hire a Well Rounded Momma midwife, we give you a big workbook, and it has a love languages quiz. It has also a book about your beliefs about birth, because we really want to know where you're at, where you and your partner are at mentally, what you think, what is it going to be painful? Do you know, do you trust your body? Do you not trust your body? Where do we need to fill in some of the gaps in education and make you feel prepared? And know that birth isn't an emergency, because that is what I think when labor happens and you lose your sense of control and grounding, because it happens all the time, and that is what it is. It's a big surrender. It's so scary, and it feels to other people that it is emergent, and it's not. And so having somebody else there, or just doing the education to remind them that it's okay, this is going to be okay, and supporting through that, we have tools to help prepare that. And so knowing what your love languages are to kind of speak to you. We don't do a birth plan. I don't need to know that you don't want monitoring constantly, or you don't want an IV, because we don't do those things. But I do want to know if physical touch is not for you, and words of affirmation, or presence, me being there next to your side. I'm not going to chart on my phone while you're having contractions in your tub, because that's going to take away from that, from me being present for you and showing my support. And so even as a midwife is not necessarily a doula, and we're not doing as much hands-on physical support, we do still comfort our clients in that need, but we help them figure out what that looks like, because we don't know. It's very unknown sometimes. And so having the tools and the preparation ahead of time is for sure a benefit of having a midwife, or just from looking into more holistic experiences in birth.
Cool. So you did mention the placenta, and I'd recently heard about placental encapsulation.
Mm-hmm.
Can you tell us a little bit more about that?
Sure thing. I actually just started doing placenta encapsulation, and women have been doing it for a very long time. Culturally, other cultures eat organ meat often. It's not very popular here, which that is, again, a very big cultural thing. I think women are now getting turned on to learning about their placentas and wanting to figure out ways to help in postpartum. And so the idea of consuming your placenta is that it has a lot of nutrients in it, and micronutrients. So like iron, vitamin K, things that you've then just been depleted of from delivering your placenta, and the hormones that you had in your body during pregnancy. And so if you were to then we dehydrate it, and then I put it in a NutriBullet blender, and then I encapsulate it. So we steam it, and then we dehydrate it, and then we grind it down, put it into pills for you. And the idea is that it's just replacing all the nutrients that you lost. So there's iron, hormones from labor, all of those things that were previously in the placenta, and it's very nutrient dense. It's replacing. There is not enough evidence to totally support that, and so a lot of medical people in a hospital will be like, no, we're not going to let you take your placenta, or this isn't evidence-based. You might get a lot of pushback on that, and that is a very true thing, but there isn't any harm necessarily. We're not seeing people get sick or get infections across the board every day from consuming your placenta. And so as long as you're working with someone who has the proper accreditations to do it and is doing it in a really sanitary space and knows how to work with, usually we have to have our food handler's card, and we have to have certification to do a placenta, because the sterilization process is really important when it comes to encapsulating. But the idea is if you were to eat a lot of nutrient-dense foods, that is still going to benefit from your postpartum hormones. Mm-hmm. In my beliefs as a nutritionist, gut health is so important. And so if we're eating things like vitamin K, so broccoli, kale, microgreens, all of that stuff, in postpartum, if you didn't want to consume your placenta, that would be helpful for you to do as well. But the idea is we're just replacing everything that you lost. And so people are wanting to consume that, and they're feeling like they're having easier postpartum moods. And it's not such a up and down roller coaster for them. And so I started taking my placenta, and then I ended up doing it in a tincture, which we can also do. I just put it in like an alcohol base after a while, and that was really nice because I feel like I'm not good at taking pills, and so dropping the dropper down in like a liquid was easier, and it helped me stay consistent with it. So there's different ways that we can do your placenta as well.
About how many pills do you take from one placenta?
It depends on the size because everybody's placentas are very different based on the size. And so usually at the minimum 60 pills, I've had like 200 pills max before. And we'll also, sometimes it depends. If you're doing it in a hospital, they'll cut the cord off completely. But if you have your baby at home, we will actually do a little heart or write love and do something really cute with baby's umbilical cord, and we'll dehydrate and give you a cord keepsake as well as the placenta. And we also make a salve with it too. So I make earth salve, which is a healing, it's like comfrey plantain, echinacea, myrrh, vitamin E, lavender oil. It's a salve that I make all of our clients, and you can put your placenta in that. So if you have like a cut or a burn or anything, you can put that on your skin, and it helps healing. So the idea is we're just putting all that good nutrients back into our body.
I love it. We're going to take a break.
Okay.
Okay, Emily, I have to ask, what's your favorite meal I don't like to say cheat meal anymore because I don't want to say that's bad, but what's your favorite meal? What's one of the most favorite foods?
Ooh, that is a tough one. My favorite meal most likely would be, so I'm Polish, and cabbage and dumplings is like a very traditional Polish food. That's probably my favorite meal. But my favorite food, if I were like, just off the top of my head and everybody knows it, would be like a corn dog from Disneyland or beignets from Disneyland.
I love it.
How'd you end up here in Vegas?
I moved out here for a guy that I'm no longer with, but it was great. It was a really good friend's brother-in-law, and it pushed me out of my comfort zone. I was living in New York City at the time, and I applied for a job at Lifetime Athletic in Summerlin, and they had only been open for 2 years, and so I came on to be a personal trainer there, which was great. I ended up growing my craft in personal training, becoming a nutritionist. I led the nutrition department, and then I got Pilates certified, and that's what got me into doing this. So it wasn't for like any other specific reason except for following my young, crazy heart, but it ended up leading me to really good things here.
Aw, that's great.
Mm-hmm.
Now, what do you like to do in your free time?
I used to go to the gym before I had a baby. I'm always with my kid, Max. He is 21 months, and we like to golf together, so that would probably be the one thing that I still get to pick up and do in my free time. I do Pilates, and I have a spin bike at home, so exercising and fitness is very important, but not as much as I used to. Before I had a baby. And then Disney. We are a Disney fam. We go to Disneyland all the time, and we try to sneak in trips to Disney World. But if I'm not on call, you can definitely find me in Disneyland.
That's awesome.
Can you tell us more about that? Because I think you have something that you told us you have a little side thing going.
Yeah. So I am a Disney travel agent with Unlocking the Magic Travel. I help families plan their Disney vacations at free of charge. And so answering questions, how to navigate the parks, how to navigate the apps. It's so much more planning than just showing up like it used to be when we were kids, probably because that was not what we were responsible for. But just nowadays with all the things you have to do in Disney, there's a lot of demands, and so I get to help people do that. And I've had a fun time taking my little guy, and so helping families navigate and experience Disney magic, even when you do have a little kid that might be under 2 and people say not to go, it's still worth it.
That's awesome.
Yeah.
So that could be an entirely different
podcast, 100%.
But let's give us a highlight on like one fun tip that not a lot of people know about that you tell people often.
For Disney? Oh man, this is a hard one. I have so many. I was reading fun facts the other day, and of course now I have like it all ran. Oh, okay. Forced perspective is a really big thing that Disney does. So the castles are built, the bricks, like at Sleeping Beauty's castle, are really big. And then as it gets taller, they get smaller to make it look taller than what it actually is. So they do that with all of the buildings on Main Street and a lot of the rides. So that way they're not actually having to build these big buildings and spend all that money on construction. The sailing ship Columbia is the exact replica of the first ship to ever circumvent the globe. And the other Liberty Bell is the one that's 5/8 scale. So that boat is like an old steamboat from like New Orleans, and it's the white one that they have in New Orleans Square that you can ride on. And so that one's actually a lot smaller, but the sailing ship that looks like the pirate ship is an actual size. So they trick us a little bit, and I never knew that. I thought it was always that big.
Oh, that's awesome.
That's
Some
interesting.
perspective too, right?
Yeah.
So tell us about kind of your differentiation between a doula and a midwife, because I think you both. Tell us about going into a birth as a midwife and how you might approach that differently than a doula, or maybe the same. Tell us a little bit kind of how your mind is wrapped around that.
Absolutely. As a doula, the biggest thing is just what I'm responsible for. So as a midwife, I'm going in there and delivering the baby. I'm looking at mom's vitals. I'm listening to baby's fetal heart tones, making sure that everything is going good and that they're well to stay home. And as a doula, I'm there just to help ground them and make them feel really comfortable and prepared to go through that process, or help with physical touch through those intense contractions when things pick up, help dads sometimes or partners, give them a break and swap out. As a doula, I'm really there as like support, whereas as a midwife, I'm going in and thinking about what is baby's heart tone, what is mom's vitals. After birth, I'm managing blood loss, listening to baby's heart rate and respiration. So there's a lot more of the medical stuff that's happening because I'm in charge of both of their well-being. As a doula, I'm looking at those things and I know how to identify if something is outside of normal. But my job is not necessarily to dictate or to speak up. It's more so to prepare them to ask questions to their care provider or even their midwife. If something's coming up and maybe labor's not progressing as a doula and we're at home, then I can even say, hey, let's, talk about what our options are. What are some things that your midwife's saying? And let's ask these questions. So helping people advocate for themselves in a doula role. In a midwife role, I'm educating them and allowing them to figure out what that advocacy looks like throughout their experience. We're building that experience, and I'm giving them the opportunity to learn and then advocate for themselves and make those decisions together. We used to say, not continuity of care, but we used to say informed consent. And I think informed consent is really important, but I think shared decision making is also really important because as a care provider, there might be a specific thing that I am asking of you for a reason, and that might not be something we normally want to do in a home birth, but there could be a good reason that I want to check this out. And so if I'm asking that, how do we kind of collaborate, or how can I educate you to make you feel comfortable to approve this, or educate you on maybe like if this isn't for you and you feel comfortable with that, I'm going to waive that, and then we just sign those consents. So it is a lot more, we're still educating, that is very much the same, but being the care provider and in charge of the well-being of mom and baby throughout their prenatal care, during the birth, and in postpartum.
Cool. What are some of your favorite parts of your job being a midwife?
So I used to not do it for the babies. I loved working with moms specifically, and I do love babies for sure a little bit more now that I've had my own, because I'm like, oh my goodness, I get to snuggle my baby like a new baby and give it back. Mm-hmm. That fixes my baby fever that comes up every so often, but I still really like sleeping when I can, so that's why we're not doing it again. So that I love. I love building families and involving siblings that have been there in their mom's care and like in the experience, because I like normalizing birth for the next generation. So that to me has been my favorite part. My very first home birth, the mom, I knew her for a few years through like just women's networking in town. And her daughter, I knew her when she was pregnant with her daughter. She had a hospital birth, and then she came to me when she was pregnant with her second son. And the whole time I got to let her she helped me with all of the listening to the baby, when we would use a Doppler in the appointment, measuring her mom's belly. In the labor, she was there and came in and like helped cut the cord and everything. So to me, that fills my cup up when I get to get that with families. But now it's also nice because I have families who are repeating the process. So babies that I get to be at, like I met them when they were coming earthside and I cared for them. Now they get to be here for this next baby. And so building families and having that like generational, I hope that Max gets to go to school with some babies that I've delivered. Aww. And that they get to be like, your mom brought us here, right? So creating that sense of community, building families is so important nowadays. We don't have that village that we need in motherhood, but normalizing birth for other generations.
Cool. What made you passionate about wanting to work with these families here in Las Vegas?
So when I was a personal trainer, I had women come to me that wanted to lose all of their baby weight, and they had a lot of traumatic stories from birth. And I thought, like, if this is really what it's about, there's no way in heck I'm ever going to get pregnant and have a baby. I'm not about that. Not at all. And so through that, I realized there was nothing that I could do as a personal trainer or a nutritionist to get people to adhere to the guidelines when they were mitigating trauma in their lives. So I then decided to become a doula to help have a more positive birth experience or more positive birth outcomes, regardless of what that delivery looks like, but just to have a say and some self-efficacy in a process that often feels like it's passively happening to you. I changed because, like even for me now, I have not been able to get consistently back into exercising or doing the bodybuilding and strength training that I used to do before, or eating 6 meals a day. Like that's not realistic for me. So coming from a place where I knew the most efficient and effective ways to like live and have optimal health and all these things, to then have to meet people and women where they're really at was a huge eye opener. But I learned that through helping mitigate birth trauma, we're helping women stay more intact and more of themselves and coming out whole on the other end of this process that lives with you forever, that really can change not just you physically, but emotionally and mentally in your psyche, and imprints on you and your experiences for the rest of your life. That, if we can change that and have a more positive outcome and leave you more whole, then how are we going to approach your health and well-being and taking care of your family and how you show up as a wife and a partner and a mother and a sister and a coworker and a business owner and a part of your community, right? So through having more educated and empowered experiences in the birth process, we are allowing women to show up and create a space for them to continue to be the best version of themselves.
That's awesome. I feel like that just like pumped me up, man.
Thanks. Yeah, man. That's what I do.
Oh, that's great. So I know that you're at Well Rounded Momma, and you have services that you mentioned that you do, but can you tell us a little bit more about how awesome your space is?
Absolutely. Antoinette has been to Well Rounded Momma. She was so nice to come to an open house, and I would love for you guys to all come and check it out. We have our office space on Sunset and Pecos, and we're right behind the airport. Well Rounded Momma is a maternity center that's been around for 10, almost 15 years. We have 4 primary midwives that work out of Well Rounded Momma, and we each have our own individual practice, but we do back for each other. So you get to really meet all of our midwives throughout our classes and coming into the center, but we offer fitness classes. We have prenatal yoga, prenatal Pilates, which I teach. We have some mom and baby classes for fitness as well. We have our amazing lactation counselor, Rory, who helps so many moms with breastfeeding support and gives resources to help them stay connected and have an ongoing breastfeeding journey. She also does car seat checks. So if you need to figure out how to install your car seat, I'm actually going to get certified on that in October too. So I'll be able to do car seat installs and checks.
Very important, by the way.
Yeah, well, and the fire department doesn't do them anymore for free. So they used to, and I used to send people to the fire department all the time, and they're like, no, because it's a liability. And the training is usually in Reno, and now they're coming to Vegas. So I was like, okay, I guess I'll do this. It's important to have. All my clients ask for it, and I'm not good at putting in my car seat, so I should very much be on top of that. I make my husband do it. So we offer car seat checks. We have postpartum support groups. We also offer doulas. So if you're looking to have a hospital birth, or even if you have another midwife in the valley, our doulas can support anybody, no matter where you're at. We offer placenta encapsulation, and I want to say that's it. Yeah, we offer well women's care and baby milestones as well. So if you do have a baby and you wanted to do some wellness checks on like growth milestones, we can also see little ones up to 24 months. So you don't have to be a well-rounded mama client. But if you did want to come in and speak to us and just talk about weight gain, milestones, things like that, we do baby well checks as well.
Cool.
Yeah, thanks.
What is something you have learned that you wish you learned sooner?
Yeah, probably to become a midwife. I am going to be 35, and I'm like, geez, man, if I would have done this when I was 25, it would be a lot easier on my sleep, and I'd be like more skilled, because my midwife, Tori, is actually younger than, she's just turned 30, and to me, she seems like my mom. And I'm like, how are you younger than me? You've been doing this for so long. You're so amazing and skilled at this, and the best midwife ever. And like, I don't look at you as someone who is 30, and that doesn't mean much of anything, right? But I wish that I would have started younger, probably. However, I think everything that I've ever done in terms of work, when I was 25, I was a personal trainer and working with pregnant women in fitness. So it's all built upon what I do, and I think has made me a better midwife, because I understand things first in a holistic matter with nutrition and health, and then I applied that to birth. So probably I would have gotten started sooner.
You're such a triple threat.
Oh, thanks. I try. I just didn't know what to do, and I needed to make money. And then I was like, you know what? We're going to be on call all the time and change the trajectory of your life. And then that's where we landed. But it's been such a blessing. I love it. I really am grateful. And I think even going through birth work myself prepared me, because birth was a scary thing for me, as it is for most women. That's really why I wanted to help take some of that fear away and support some of that and replace some of that. And so even just as me being a mom, going through doula and midwifery, and just understanding and respecting the natural side of birth. And when you have a baby, babies are strong and resilient. They're not broken. They're not weak. There's not something that's always wrong with them. Trusting your body and yourself and trusting your motherly instincts is something that has been really beautiful for me to be able to learn and grow into.
What's something that you would like to leave the listeners with?
Trust your gut. If you are ever in an experience with any care provider, no matter if it's a birth experience or not, know that you are in charge and it's your body and your right to ask questions and receive answers for you to make an informed choice, no matter what setting you are in. You have a right to informed and quality care.
I love it. And Emily, how can people find you?
You can follow me online on Instagram at Expecting with Emily. I also have a website, and that's www.expectingwithemily.com. You can also find me on the Well Rounded Momma website, or call our office at 702-478-5080 to schedule a consultation.
I love it. Thank you so much, Emily, for talking with us. It was really fun to have you on.
Thanks so much for having me. I love chatting with you guys. Thank you.
We'd like to thank you for listening to La Vida Las Vegas podcast. We hope you enjoyed the time with our guest as much as we did. It would help us out so much if you could share, subscribe, or review our podcast, or any combination of the three. Thanks again, and remember to take care of yourself.